Today I'll be talking to you about the topic about the knowledge, attitude and practices of radiology in dental practice. Basically I'll be including the following contents, why we choose this particular topic, the aims and objectives, a little bit of review of literature, the materials and methods of how we did, the results and the discussion. All of us know that in dental practice, ionizing radiation is very commonly used when we use the X-rays. We have conventional X-rays, now we have come to the digital X-rays, the cone beam. So we use lot of X-rays which is ionizing, and we felt that it is one of the very important diagnostic tool which is used in dentistry and in for diagnosis and various other purposes. So basically in United Arab Emirates there was very limited studies related to the awareness and the knowledge of radiology practice. So we thought of choosing this particular topic to see the knowledge among dentists. So the aims and objectives was to assess the knowledge, attitude and practices of radiology in dental practice among the UAE dentists, also to assess the knowledge of radiographic prescription used for diagnosis, to identify the type of radiographs most commonly used in dental practice, to assess the knowledge and awareness about the radiation protection devices used in dentistry, to also to identify the type of radiographs used in specialized dental treatments. So we had a 16 questionnaire questions made, and we distributed among the various clinics in United Arab Emirates. We have 7 Emirates. The sampling was convenient sampling, and 300 questionnaires were distributed, out of which 220 were returned, and the data was analyzed using the SPSS version 22. So the results what we got was the age groups among the dentists what we distributed was majority of the dentists were between the age of 30 and 40 years of age, and majority of the dentists were having some kind of a postgraduate qualification with some fellowship, diploma or some master degree. And most of the dentists what we assessed were having the experience between 11 to 20 years of experience in dental practice, and the situations in which they prescribed the dental radiography was mostly most of the 88%, 88.9% of the dentists used for initial diagnosis, and very few of the dentists preferred to use radiography during the treatment and after the treatment. The type of radiograph most frequently used by dental practitioners were intraoral periapical X-ray, followed by bite wing and the panoramic radiograph, which was less than 50%. And majority of the practices had digital radiography in the intraoral devices, and most of the dentists, around 78% of the dentists were aware about radiation protection. So majority of them knew only about lead apron to be used during the radiography. When we asked about the radiation protection devices to the patients, most of them had lead apron and they used this particular device. They were aware about, most of the dentists were aware about the ALARA concept. And the extraoral, when we came to the extraoral imaging, majority of the dentists preferred to use a panoramic radiograph in various diagnostic purposes. And the reasons for using the extraoral imaging, majority of them preferred for diagnosis and also for the surgical and the implant assessment. And very few dentists were using for orthodontic practice. The question which contained about the awareness about cone beam CT in dental practice, in our study, majority of the dentists were very less aware about this particular new technology. That is, when we asked about whether they are using cone beam CT in their practice, most of them were not aware about this particular thing. And when we asked what was the reason for not having this particular, they were not using this CBCT, they were having a mixed type of question answers like it's very high cost, or majority of them didn't know about this, and only very few percentage, less than 5% of the dentists only was aware about this particular technology. So when we asked about the imaging in implant dentistry, majority of the dentists still prefer to be sent for a panoramic radiograph or a CT examination. But they all agreed that radiological investigation is very important in implant planning. So we found a lack of awareness on the different radiation protection devices other than lead apron. Like for example, we asked about the barriers to be used, some kind of a thickness of the wall. If there is no, if you cannot go outside the room, what is the other options they do? Most of the dentists said that they sit chair side and they just expose the radiograph. So these are all the things which made us conclude that they didn't have any, they were less aware about the radiation devices other than lead apron. They were all aware about using lead apron. So none of the dentists reported to have using dosimetry. I will tell you the reason, what was the reason for that. None of the dentists reported awareness about the advantage of or disadvantages of CBCT, and they didn't even tell, okay, there was a center of cone beam CT which gives a service in one of the Emirates, Dubai. We have in our university a training center on CBCT, but majority of the dentists were not aware about the services being provided like this. And coming to the discussion part, in United Arab Emirates or most of the countries, we have a regulatory authority for guiding for this ionizing, which controls the ionizing radiation. In United Arab Emirates, Federal Authority of Nuclear Radiation, which is under the ministry, is controlling any activity which uses ionizing radiation. They have a strict guidelines, but in spite of this, even if you are opening a dental clinic, you should follow all the guidelines, and then only you should have a license, then only we start the practice. So the purpose was to give the dentist more awareness about this particular guideline, and the imaging, whatever the dentist does is to give a high quality images with minimum radiation exposure. So coming to the use of radiograph on the initial visit for diagnosis, as per the ADA recommendations, we have a published guide that a diagnostic radiograph is mandatory. And also there are various articles like Shahab in their study in the Iranian dentist regarding the oral radiology safety concluded that 44% of the dentists said that the initial radiograph they took was of the intraoral periapical radiograph. In our present study also, 89% of the dentists used radiograph for the initial diagnosis. The type of radiographic conventional versus digital, there are various studies which states that digital radiography is a reliable imaging technology that helps the dentist in diagnosis compared to the conventional radiography. In our present study, 30 to 40% of the dentists were having digital X-rays in their practice. So coming to the radiation protection awareness, Jacob et al. In their study concluded that awareness about radiation protection to dentists can be improved by more educational programs and thereby change in the attitude towards the use of ionizing radiation. This is very important. And in the present study, 79% of the dentists were aware about radiation protection. So coming to Yamalik in 2013 concluded that more effort should be given to improve the knowledge and awareness about dental practitioners with regard to radiation protection and to develop a patient safety culture. So in our study, 1% of the dentists were aware about ALARA concept to be used in radiation protection. Jacob in 2004 concluded that minimum awareness was present about the devices used for radiation protection by dentists. And in their study, female dentists used lead apron during an exposure more compared to the male dentist. And also they found out with the dose estimation that larger effective dose was received by male dentist, which is around 8.3 microsieverts to versus 3.2 microsieverts among female dentists. So in our present study, 64% of the dentists were aware about the use of lead apron, but many of them were telling that they may use or they may not use, but they were aware about this. So none of the dentists were using any personal monitoring devices in their practice. Also, other protection devices, they were not aware. As I told, they were all exposing by the chair side. So when we came to the extraoral imaging and its indications, there are various articles which states that whenever we indicate a patient for an extraoral imaging, the clinical judgment is very important to maximize the benefits and minimize the harm. So in our present study, 34% of the dentists preferred panoramic radiography for diagnosis, while 28% preferred panoramic radiography for dental implants. So when we came to the awareness about cone beam CT, in a study in 2011, which concludes that more than 50% of the dentists were aware about cone beam CT, Greenberg states that thorough knowledge of CBCT as well as the ability to interpret the images correctly. This is very important in interpreting a cone beam CT image. In the present study, as I mentioned, 95% of the dentists were not aware about the cone beam CT. Role of radiology in dental implant treatment. Reddy et al. In 1994 evaluated the advantage of computer tomography in comparison to the routine panoramic radiography for dental implant treatment planning and concluded that dentists were more confident using computer tomography and panoramic images than panoramic radiograph alone. And in the current study, most of the dentists did not know where CBCT is available, and 71% of them referred their patient for panoramic radiograph, while 29% still used computer tomography, which used very high dose of ionizing radiation, especially for implant planning. So coming to the conclusion, awareness about dental radiation protection is to be given to the dental practice periodically, which is very important. Awareness about the national guidelines, whichever country has a national guide, every country will have, that has to be emphasized. A continuous education program has to be given. Encourage timely updation of recent advances in radiology. I forgot to just show one slide. In the Federal Authority of Nuclear Radiation in United Arab Emirates, they tell that dosimetry is not needed for dental practice, because the reason what they justify in their guideline is the exposure for the worker should be less than 20 microsieverts per year. It should not exceed more than that. And with various continuous monitoring, they have found that it is still less than 20 microsieverts, and in a 5-year period they give a maximum dose of 100 microsieverts, and that is why they have recommended that it is not needed. But it is always better to use a dosimetry so that to know how much of exposure is going around the radiation practice. Thank you. If you have any questions, you can.
Thank you, Professor.